making Orthopods rich. And who other than Dr. Ramnath Guthe sir to have this lecture for us, this session for us. He's one of the best to teach finances in the country for the doctors. Very good morning and welcome to Navi Mumbai Orthopaedic Conference NMOACON 2023. It's indeed privilege and honor to stand before you today to introduce our distinguished guest, Dr. Ramnath Guthe sir. He is not only a luminary in the field of radiology, true visionary in the realm of healthcare. Dr. Ramnath Guthe sir completed his MBBS and MD radiology from the prestigious St. G.S. Medical College and KM Hospital, Mumbai. His academic journey laid his foundation for his remarkable career, which has been marked by excellence, innovation, and an unwavering commitment to the medical community. But what truly sets Dr. Guthe sir apart is his dedication. His dedication to empowering his fellow doctors beyond the confines of medical practice. He is the founder of you all know, WealthCon Group. It's a groundbreaking organization, that is what I can call, which unites almost now nearly 70,000 doctors and which is aiming to provide a very crucial financial education. Through a wide range of offline, online courses, dedicated Telegram groups, WealthCon has been instrumental in equipping the doctors with the financial knowledge, which is very much a need to secure their futures and better serve their patients because their dependency on the finances from their core practices are reduced. So they're able to better serve the patients. In addition to these financial endeavors, Dr. Guthe sir is also a driving force behind HealthCon Group. This recently started initiative is dedicated to a healthy lifestyle, notably known as a HLR regimen. A lot of people in this hall also are following it, which is promoting a healthy lifestyle. Notably, and thanks to his effort, nearly 5,000 doctors have already benefited from this invaluable guidance provided by this HealthCon Group, and not only improving their well-being, but also enhancing their health of overall all the communities. Even the families are also there in the part of that group. Dr. Guthe sir's commitment to the medical field goes beyond the diagnosis and the treatment. It extends to the well-being, prosperity of our all fellow medical students, medical professionals, and his efforts, tireless efforts to bridge this gap between the financial literacy and the healthcare has underscored his status as a true pioneer in our industry, a true legend for us. And today we are really fortunate to have Dr. Ramnath Guthe sir to join us as a guest speaker for NMOACON 2023. His insights and experiences, I'm sure that it will inspire us to explore the intersection of orthopedics along with the holistic healthcare. Our theme of this conference is ethical and affordable. So without a further ado, please join me and enthusiastic welcome to our visionary consultant, Dr. Ramnath Guthe sir.
Today's 60 minutes, the discussion I can start is as aims and objective of this next 60 minutes or talk. I'll focus on the passive investment. That means all of you, at least after the talk, you will know what is passive investment and how to do it. That is first goal. I'll not go into the trading discussion because 1 hour is very less to explain anything in a trading. We'll focus more on wealth creation part because all of you are young, between 30 to 60. After 60, it is more of wealth protection. So main focus is on wealth creation. And this is financial education. So next comes is what are the boundaries or what I'm going to talk and what is not. So you will have expectation. What can you expect? If you feel this is not suitable to me, you can take a mobile and start studying on that. We will not discuss tips trading. Tips trading is Investment based on the tips. Tips from the TV, tips from the friends, tips from any tips giver. We will not discuss anything about intraday because I believe doctors should focus more on practice, not on the chart and waste their time. Previously, when we started WillCon in 2017, we had our group was very small, so we used to discuss intraday. But as group increased, then I realized that if 50,000 or 1 lakh doctors sit on the computer and seeing the chart, it will be huge loss to country. That is one thing. And you will lose the patience, you will lose the stock market intraday as well. So we strictly say that we don't do intraday trading. Then penny stocks means small stocks which are useless stock, those comes and go. And something called as stop loss trading that I am not going to discuss. I will not discuss cryptocurrency because this is not regulated product. And RBI governor said that crypto is nothing but it is the less than the tulip as well. It has no value. So I will not go into any product which is not regulated or not legal as such. Similarly, network marketing scam. Many people who are doctors get into the quick buck scams and they lose money in network marketing. So we don't do it. I will not discuss trading or anything about chart. I'll give a clarification. There is no conflict of interest. I'm not going to sell any policy, any plan, no PMS, nothing. This is a purely educational. Last thing in this, that bee swan. There is a mythological story in our Hindu literature. If you offered, there is something called as Rajhans. If you offered milk and water, Rajhans take only milk and discard the water. So you take whatever it is suitable and you discard whatever it is not suitable to you. So I'll start with the story of Dr. Amit. I am not showing his face, but some of you may connect with this face. He is an orthopedic surgeon, is doing good, age 40 years, 44, and he was seeing 50, 60 patients per day. He was doing good. He was paying EMIs. He was paying ignorance policy premiums, and he was buying stuff. Everything was going well, but suddenly then COVID appeared and practice stopped. Because lockdown, there was no accident. So practice was hardly there. And for chronic backache, people will not go because of lockdown. Income becomes zero. How many of you have faced this scenario? Please raise your hand. Income becomes zero or negligible. Right. So this is a two-way discussion, and I'll speak by word and you'll speak by your hands. Because otherwise, it's a discussion to hote rehte. How to pay EMI, how to pay bills, and then suddenly friends started, let's start trading in stock market. So they opened Demat account, he opened Demat account, and he started intraday trading, he started buying options, and he lost money there as well. So from zero to hero, it is not that way. Okay, you should go step by step. Then he realized that I need enough capital so that if next time COVID returns or maybe influenza or a different version come and there is lockdown for 1 year, I should be financially independent and freedom. So this question is a philosophical and financial as well. How much is enough? How much is enough? For the person who do not know finance, there is no limit. So, but at least you should know how much is enough for me. Everyone has a different aspirations. Some people, how much is 100 crore, 1000 crore. But if you take Indian scenario, 10 crore liquid asset is enough for 99% of the people, 3 standard deviation data. If you want to customize yourself, this is the formula. You take the liquid asset, entire value of liquid asset, divide by the annual expenses. And we call this as a wealth index. And if it is more than 20, you consider as a wealthy. Now the topic or name of the topic is make orthopods rich. Am I right? I think this is incomplete. Why? Orthopods are already rich. How many of you agree? Already rich. We want to make them wealthy. And that should be the topic of discussion. Right? So what is the difference between rich and wealthy? That I am going to explain in a numbers. So write down, if you have pen, they have pen and pen. Phone पे करो, एक calculation करो, wealth index बता दो, 10 seconds. It's yours. I'm going to take poll, wealth index. You can do mental calculation. Liquid asset does not include home. How many of you are 20? Please raise your hand. 10? More than 10? Good. More than 5? So you have to work on it. If you see the pattern in any country, this is not limited to India. If you take the US data, it is the same. Because the financial behavior is genetically encoded. It is not cultural. Anywhere in the world you go, that 80% of the wealth is in the very few people, 5% people, in the hands of 5% people. 95% of the people are just living to dead, living to die. It means they are living because they are not dead. They are struggling to just survive. They are not going into the wealth creation zone that I call it as a 5% club. Because it is not about money. It is about belief and behavior. If you see the poor person, now this poor has a very less income, spending is also less because of income is less. They still take a loan, they don't have they don't have any asset. Middle class income is little better, but they have more spending. So they take huge loan. So this class is a consumer class. Assets are very less. Third is rich people. They have huge income, but huge expenses as well. No saving. Those are rich. And assets are minimal, liquid asset. And when I said, how many of you have more than 10? Only 2 people raised the hand. It means you already have significant of enough. And if I see the age is more than 40, it means minimum 10 years practice is done. 10 years practice of orthopedician, I can expect they should have liquid portfolio of at least 3 to 4 crores. Minimum 2 crores. Itna hona chahiye tha. If it is not, then you have made some mistakes. Who is wealthy and rich? Wealthy people also have the income, but their expenses are less. We can say income or expenses, very wide gap. They don't have loan. If you have a loan, you are not in a wealthy class. Whichever type of loan, whether it is commercial loan or personal, especially personal or home loan, etc. And they have huge assets. As I said, this is a belief system and behavior. If you see the words, you just observe anywhere. If person speak about Sarkar is not doing for us, where are you doing jobs, local politics, what is the rate of bhindi, potato, you can consider this is a person from the poor class. This is not discrimination, but just understanding purpose. As I said, this is for understanding purpose. We are not judged that what is right or wrong. Middle class will speak about EMI, Santro car, maybe Tata, Indica. They will speak about gadgets, they will talk about Modi ji and national level politics. Poor people speak about local politics, middle class people speak about national level politics. They will speak about Shimla, Manali, 7th pay commission, 8th pay commission, because they are salaried people. And their photos on Facebook will be same. That mid-range car and Shimla, Manali, and if it is not NEET or GE or some competitive exam. Because nowadays prestige is not in the car, now it is nowadays prestige in the children. Kiska children ko zyada marks milta hai. So they will speak about classes and all the things. This is the middle class. Rich class will post the photos of Mercedes, of Europe vacation. They will have bungalows photos, parties, etc. Because they have a lot of money to spend. Wealthy class speaks about valuation of the company, valuation of business, capital, asset, business. These are the words. If you find the words, you can find out the class. You can find out the class based on the Facebook photos. It is not about money, it is about the mindset. People have the mindset. So if you want to go into that class, first you have to change the mindset by financial education. What are the beliefs and myths related to the money? Money is not important. But whatever is important needs money. Good health needs money, good education needs money. If you want to have good life, you need money. So you have to remove it. That belief. Money does not buy happiness. Whoever says this, he does not know what is happiness. Because up to certain level of money definitely increase happiness, and absence of money is sure shot cause of unhappiness. Do you agree with me? Absence of money certainly brings unhappiness. So you need money. What I am speaking about the bits and how to change. It is not my cup of tea. I say, if it is not my cup of tea, you get the glass of beer. So these are the all softwares. It is easy to change these myths. Finance is not difficult. Finance is difficult, but active. Reality is 7th grade child can also do the better investment or learn. It is not as such difficult. Share market is satta. Although share market is satta for some people, but for educated people, it is not. So I'll speak about this financial education and personal finance. So these are the headings we speak about personal finance. This was earning, spending, investment, taxation, insurance, and loan. I'll speak in a brief about each topic. What is active income? So earning, active income, semi-active income, passive income. Active income comes from the work. You have to see the patient, you have to do surgery. If you are not going, no income. I always say doctors are daily wage labor. Every day you go, you get. If you don't go, you don't get earning. Am I right? And we have to do it because as a profession. So this is, just understand we are not going what is good and bad. Okay. Semi-active income comes from the managing either money or people. So if you have a business where you are not doing surgery, but you are sitting in the CEO chair and managing other orthopedic surgeon or other people, that is semi-active income. Even if you don't go 1 or 2 days, that's okay. Even if you stay 2 weeks away from hospital, still show running, that is semi-active income. It can have some system as well, technology based. Or next is passive income. This is a royal income, okay, where you get income from the royal, some ownership partner, ownership dividend, or yield, that is interest. Some if you are author or some rights, you get that, and long-term capital gain. Can I stand there so that I can see there? Okay, you sit there because I feel all right. You sit. I'll stand here because I am not comfortable behind it. So this is earning. 3 types of earning: active earning, semi-active earning, and last is Passive earning, royal. You don't have to do anything, you just have to withdraw money. That's the royal income. And ultimate aim should be that. So if you go that level, you are free, you are not worried about COVID or influenza. So there is a Parkinson law. It says that no matter how much money people earn, they spend entire amount and save little. Why? What is the reason? Because in a medical colleges or in a school colleges, we are taught to generate the income by technical skills. We are never taught what to do with that income. There is no education. So what happens as soon as you start hospital or clinic, you start seeing the patient, you get the income, and then agents will start pouring. They will sell you ignorance plans. Then many people broke property real estate agent will come, sir plot dekhte hai, cash dal do. And this thing will go, and then some friends will buy big car and you will also buy. So you are not aware what to do with money. Half part you are aware, half part you are not aware. That's the reason this trend is everywhere in entire country. Even if your income increases, spending increases, saving is less. Where do we spend? We spend on two things. I call this the pops and pons. These are our own terminologies. Products of need and products of prestige. Products of needs are required for the survival. You cannot have a good life. So first part is a good life related things. It will have basic car as well, even little advanced car. And all the things, roti, kapda, makan, education, health. All these are products of need. Products of prestige are the discretionary item, or it has some prestige value. Jewelry or big items, big gadget. How to differentiate? When I used to give a talk offline at Pune in 2018, so one lady started saying, but jewelry is my product of need. I said, yes, I can agree. When do you wear jewelry? Do you wear jewelry in kitchen, at home, sleeping? No. You wear jewelry only when you are going out. Similarly, when you are buying something just to show at the party, this is product of prestige. Difference is very clear. You can find it on status of WhatsApp of people, Facebook. Whatever posted on that is the product of prestige. Clear cut. If jewelry you are not wearing at home, it is products of prestige, not need. This is how people say. This is very new, it's very interesting. People take car on the EMI and all their friends know that this is EMI car and still they try to get prestige. It cannot. If you want to look rich, you should be rich. There is no point. And if you are rich, it will be seen. You don't have to tell other people that I am rich. You don't have to tell people that I am intelligent. It has to be seen. But this is a human need. I am not criticizing, we are just understanding what is this. Now next point is investment. We discussed earning, we discussed spending. So take home message from spending is spend on need, save so that you can invest. Now people will start arguing. If you are earning, when to enjoy? First thing you need to differentiate. Spending is not enjoyment. Spending does not mean enjoyment. Those are two different concepts. There are many things you can enjoy without spending as well. Right? Now you all are adults, so you know what are the best way to enjoy without money. So dissociate enjoyment from the spending. You can enjoy many things without this. Now let's come to the investment part, that is more important. Maximum investor, maximum doctors use the method of investment. I call it as a dal diya. Paisa dal diya. 5 lakh dal diya, 10 lakh dal diya, 40 lakh dal diya. This is one method, it is called as dumping, dal diya. If you ask, when you are going to sell, I do not know. When you buy the plot, when are you going to sell? No. Why did you buy? Paisa aaya tha, dal diya. This type of investment has no exit plan, no goal. Why are you doing? Don't know. Sab dal diya. Just because you have surplus money, you are just dumping it. And the advisors are agent who load your with the commission products, and the friends. They are also, everyone is the same. Everyone is doing the dal diya. And some people wants to double money, so they do into some scam and policy, some plans. And they have huge investment products like wardrobe, different plans of fancy products, PMAs, sector funds, and all those different plans. Every year they are buying new plans. I always say fashion looks good only in wardrobe, not in financial portfolio. Financial portfolio is very boring. They take money, they take advice from the social media news. So investment is always with exit plan. Investor, do the calculation. Investor, find out what are the cost, what will be the tax, what will be the risk, what will be the return. And they invest into the asset which are standard asset, and they need education. So investor and dal diya is a different. So let's start with the discussion about investment. Before investment, we have to understand what is money. Many people say that these notes are money. Actually, money is neither notes or coin, nothing. Money is a concept. The way we have God, God is a concept. And for God, we have symbol of Murti. But Murti is not God. We all know Murti is not God. God is a concept. Similarly, money is a concept, note is a symbol. Nowadays, we are not using notes. We are getting the SMS. 2,000 rupees is debited from your account. So money is now SMS. So money is just number on the computer of the banks. So what is money is the just number, and it is used for the valuation of goods and services, exchange of goods and services. Let's say if you do surgery, and in a barter system, people used to give goods and exchange. If you do orthopedic surgery, some farmers say, take this jawar, 10 quintal. It will be difficult for the exchange. So money is the medium to exchange. What all us are doing is the first, we are providing services, we are getting money. And what we are doing with the money? We are buying with goods and services. As of now or future. So in a personal finance, whatever we are doing, spending money is spending. What is investment is the future spending. If I ask you a question, why are you investing? The answer is future spending. Either you spend or your children will spend. But it is a future spending. So what is investment? Investment is the future spending. Okay. What people do not know, majority, that money can be earned from the asset as well. So this right side, everyone is doing goods, creating money, buying the goods. Very few people knows that it can create it from the asset as well. So if you consider water cycle, water means goods and services, and cloud is money. Okay. So from one place, from sea to land, it goes via cloud. So money is cloud, goods services is water. But nature cannot create clouds from cloud. But money concept is a human construct, so we can create money from the asset. So that is where I say passive investment comes from the asset. What are the assets we speak about? We speak about grade, gold, real estate, equity, debt. Sharp. I'll share the PPT so you don't have to take photograph. PPT I'll share. Okay, so it is with the sir, or he will share with you. Our PPTs are open. We don't restrict PPT because I know even if PPT is shared, it will cause a financial education and no one can give talk because of my PPT. What is written is not important, what is speaking is important. So the gold, real estate, equity, debt. Why we stick to the standard, conventional and regulated product, so that you will not, we are aware of this. You can learn, you can use it. So under gold, we can buy sovereign gold bond or gold bees, that is exchange traded fund. In real estate, land, plot, house, and real estate we don't discuss at WealthCon because everyone has loaded with real estate. And what is the reason? You know it. Because real estate is the only where you can dump the money. So we don't need much further discussion on the real estate. We discuss more on the equity, gold, and debt product. Equity products are ETF, shares, mutual fund, in which flexi cap, large cap, mid cap, small cap, ELSS, and debt product are government security, FD, PPF, mutual fund, in which arbitrage mutual fund, liquid fund, and gilt fund. These are mutual fund which invest into the government security. Okay. These are very easy to understand and analyze as well. Okay. During question answer session, we will discuss again this product. I'll just finish one or two PPT slides, then we'll start discussion, question answer, right? Insurance. This is the pain point. Pain. Because many of you might be having the insurance plans, which are investment plans. And as I said, ignorance plans is the nothing but the investment plans of insurance company sold by smart people to ignorant people. Now this is little hurting, but that is what my intention is always. So whoever is ignorant, we have to make them, they are ignorant. If they don't accept, they don't do it. If someone accept that this was my ignorance, they will work on. So our intention is they should make some actions. So in insurance, you need a term insurance. That is pure term insurance, life insurance. How much? It should be more than, it's expenses, annual expenses multiplied by 20. So that even if you check out the planet, the family can sustain comfortably. Health, individual health insurance policies, and medical costs are increasing day by day. And as I learned that topic is theme of the course is CME is the ethical and affordable practice. Affordable, it means we are accepting that medical cost is going high. When we become a patient, that cost will also pinch us. So we need to have adequate insurance as well. Indemnity, every now and then people are threatening to show some surgical, and you are most vulnerable because surgery, it can happen anything, and you need that insurance for the protection. And some cars and travel insurance, which government makes it mandatory. Loan. Previously, people used to have loan, slaves with chains. Current people, slaves are bonded in the EMIs, not a physical chain. So EMI is nothing but the chain. You are bonded. And you will not understand you cannot guess how much EMI pressure comes into you. I'll tell you, when any doctor start practice, first 5 years or 10 years, half of his life is dedicated to the agents, banks, companies. Companies may be personal products where we are using POPs, and professional as well. In the morning we were discussing, if orthopedic surgeon, if there is a surgery, X amount of surgery, TKR, I asked straight question, TKR patient done in the corporate hospital, how much doctor gets? Just percentage wise, how much doctor gets that as a professional? Anyone? TKR. Percentage, tell me, not amount, percent. 10, 20, maximum 20, maximum 20. Now in that 80%, where is that 80% going? Start thinking, because theme of this entire CME is also that whether you should work harder for the companies. So let's go to the, I guess I made a point related to the professional. Let's go to personal as well. When you buy a big pops, we have to pay EMIs, and EMI goes into subconscious mind. Every time you speak with the patient, EMI is in your mind. Why? You have fear. If I don't treat this patient, do surgery, this patient will go to the someone else. You have no confidence that you don't need surgery. This is conservative, this is fracture is not displaced. You definitely don't need surgery. You don't have confidence if you have EMI. Because in your back of the mind, what if I don't do surgery? Who is going to pay EMI? So if there is indication, you directly say you do surgery. Jhanjat khatam. For gray area, this is where your dilemma comes, ethical dilemma. That is the topic of discussion. Now that is very big topic. Ethics has more question, less answer. But at the gray area, where there are decision algorithm, let's say you want to decide whether patient go for surgery or not. If there is dilemma, finance comes into picture. And EMI push you to the surgical side. This happens subconsciously, whether you are aware or not. If you are already wealthy, you have enough capital, you say, it's not required, I don't want. Patient say, I will go to some years, go to hell. But this is my ethics, and I will not do, at least when there is indication or not indication. What I am trying to say, ethics is a gray area. It's a complicated topic, but at a personal level, you know that this is a gray area, and I know surgery is not required. That time you have split in mind. It is called as spiritual dissonance. There is something called as cognitive dissonance, something called as spiritual dissonance, where your inner mind says surgery is not required, but your practical or professional expediency says it's required. And the cause is this: finance. If you are fully free, you will free yourself from the time on peace, and life will become happy. Because freedom is very powerful. It is not just a political freedom. Financial freedom is more than the political freedom, because you have options. What is money? Money is the power. You have options. What are the options? If someone in family got some disease, if you have money, you have options to choose different modalities. You can go. But there is no money. You have only one option, to government hospital. Money creates option. If you have money, you have choice to take medical seat for if your child to the management quota. You have option to send children to the abroad. You have options, and that freedom gives you a peace of mind. So this is a discussion PPT. It is very small PPT. You can start asking questions.
Thank you, sir. Thank you, Guthe sir, for the nice finance talk and enlightening us. There are 2-3 slides, mostly the same questions everybody asks. मैंने डाल दिए हैं. किधर डाला, क्यों डाला, nobody knows. And just put by somebody saying, because in our MBBS and PG course there is no finance knowledges. So we earn money and then maybe some agent and everybody takes. So, sir, can you just talk on this topic? And second question was that investment were 3-4 types: the gold, the real estate, the assets, the mutual funds. Is it different in the different age group?
Yes, I'll speak. So before that, I'll run the video.
स्पिरिट ऑफ एंटरप्राइज जो है लाइफ में, मैं आई रियली
Just run the
एडमायर,
video.
यू आर अ सीरियल एंटरप्रेन्योर और आप जब से रिटायर करें तब से यू हैव अ हेड फॉर बिजनेस, ये कहाँ से आया, वेयर डू यू थिंक इट्स कम फ्रॉम?
जब मैं टेस्ट क्रिकेट खेल रहा था तो हमारे मैनेजर थे चंदू बोर्डे, ही वॉज अ फॉर्मर इंडियन कैप्टन, वो था। एंड हम बॉम्बे में टेस्ट मैच जीते तो चंदू भाई आके बोले मैं जा रहा हूँ पुणे एंड आई सी यू द नेक्स्ट टेस्ट मैच। तो 3 घंटे के बाद देखा चंदू भाई अभी वहीं है। बोडे साहब, मैंने कहा बोडे साहब आप गए नहीं, आप तो पूना जा रहे थे। कहते नहीं वो ना सेक्रेटरी बोर्ड का वो सो रहा है, वो उठेगा तो मेरा डेली अलाउंस देगा। उस एक स्टेटमेंट ने मेरी ज़िंदगी चेंज कर दी, इसलिए कि यार ये हमसे भी बड़े क्रिकेटर थे अपने टाइम में। आज ये नौबत है कि ही हैव टू वेट फॉर हिज डेली अलाउंस टू गो बैक, एंड दैट इज़ द टाइम आई स्टार्ट थिंकिंग कि नो, ओपन योर माइंड कि क्रिकेट ही सब कुछ नहीं है। क्रिकेट छोड़ने के बाद ऐसी कभी नौबत मेरे को आई तो बहुत बुरा होगा, क्योंकि जब आप खेल रहे हो तो योर थॉट प्रोसेस और लाइफ स्टाइल इज हेयर। बट अगर इससे नीचे आ जाएगी तो यू विल स्ट्रगल, यू विल बी बिटर एंड यू विल बी अनहैप्पी मैन। तो मैं यही कहता था कि नहीं मेरे को कुछ ऐसा करना है जिससे मेरी लाइफ ऐसे ही रही जैसी।
Right, so this was the why, and now I'll explain how. And that is the question, how to invest into gold, real estate, equity and debt. The ratio I suggest for the young or middle age is the 10, 40, 40, 10. 10% portfolio in gold, 40% in real estate, 40% in equity and 10% in debt. This is for the your age group. Beyond 60, reduce your equity component, reduce your real estate component, both, and shift to the debt component. The difference between debt and debt product and equity product, debt product value do not go down. Equity products means related to share market, product price can go down. If you invest 5 crore, it can become 3 crores in next year. It will rise, but it is fluctuating. It is called as volatile. So after 60, your debt component should be more. How much more? Now there is no standard formula, customization, but you keep at least 70 to 80% entire thing in the debt product till you check out the planet. Gold up to 10%, because gold, equity and real estate, their cycles are different. If equity market goes up, gold go down. If equity market crash, gold goes up. So your portfolio will have a stability. Proportion I told. What to buy? See, there are 5 questions of investor. Every time you have to answer. What to buy, when to sell, how much to buy and how to buy. Once you know the 5 answers, done. What to buy for passive investment? Gold based sovereign gold bond. How to when to buy? I say buy every month, and whenever price goes down, you buy additional. So second answer is when to buy. When to sell? It is after 7 years, 8 years, when your financial goals are reached. What are the financial goals? Those are your retirement and child related goal, and then other goal may be enjoyment. So those goals, according to me, your goal will be long term goal, 7, 8 years. So you can dispose that investment that time. So when to sell? After 7 years, 8 years. This is for passive investment. How much buy? I told a proportion. If you have income, 1/3 of income should go to the investment. Let's say you are earning 10 lakhs. 1/3 minimum. You can invest more as well, but minimum 1/3 should go into the investment. And then you can divide the proportion. So minimum 50,000, 1 lakh you will invest into the equity 20,000. If you are investing 1 lakh, then some 20,000 in gold and then equity, something you do your own. Then last question is how to. We call this as automatic buying, and the word is SIP, Systematic Investment Plan. This is not SIP of mutual fund. SIP is just a method of investing. Every month it is automatic. You don't have to think, because whenever there is a decision, we postpone decision. So automatic investment by automatic software. You can directly buy via different broker platform. So that was the fifth answer. In a gold, there are products, gold coins, SGB and gold bees. SGB is a sovereign gold bond issued by RBI. That is number one product if you are investing in the gold. Reason, the capital gain is tax free. Reason number two, it gives you 2.5% interest rate on the face value of the gold. So these two benefit surpasses all the gold products. And gold coin, there are some making charges, at least some making charges, and you have to, we can say, put in the locker and other charges. So number one in gold is sovereign gold bond. It's very easy, you just log in the broker and post the order, finish. Second is gold bees. What is the difference between gold bees and gold SGB? SGB is a bond, gold bees is a exchange traded fund. If you want to sell before the redemption, or let's say in 2, 3, 4 years, then preferably gold bees is preferred, because you will find the buyers. For SGB, you cannot sell if there are no buyers. So for liquidity, gold bees is better. Return wise, SGB is better. Next product comes to the equity. In equity, I suggest start with the exchange traded fund, Nifty bees and junior bees. You start buying it. It's very easy. 4th standard child also can do it. You don't have to do analysis for Nifty bees, junior bees, because they invest into the index, Nifty. You don't have to track the portfolio. Expenses is less than the mutual funds as well. And Nifty bees and junior bees will beat 95% of the mutual fund in India. Passive investment, still they will beat. The reason, mutual funds have their commissions. That is the one reason. So I explained what product to buy in the equity, ETF, Nifty bees, junior bees. Second is shares, direct shares. How many of you are buying direct share? Please raise your hand. Direct shares. Now this is very easy. Many people say, I don't know. I can explain in 5 minutes. How easy is it? So tell me the products you are using in the morning. Toothpaste, tell me the name. Or you can make the list of the products you are using in whole day. Toothpaste, mobile company, bank, petrol, car, every products you make a list, at least 50 companies you are using it, and just check their MPTD status. That is called as WealthCon MPTD criteria. So I'll show MPTD criteria here. Tell me any company products which you are using. In the morning, Colgate. So you just find out the type. This is the website, screener.in. It's a free website. Colgate, can you see this?
Yes.
First thing you see the market capitalization. Market capitalization is the total value of the company. Total value of company, if you want to buy entire Colgate, you need 54,000 crores. It is a number of shares plus multiply by share price. So it should be more than 10,000 crores. So first criteria is passed. Then go down, click on the maximum and see this chart. If it is going upward, this is passed. It is difficult. Is it difficult to find out the chart upward? So this is a price chart. Next is tax, dividend and sales. Okay. So go to the down here only and go here. Next is tax. So operating activity, there is something called as a direct tax. You see the number, forget minus sign. it is increasing year on year. You just have to see that it is going upward. No calculation, just eyeballing. एक सेकंड में समझता है कि it is going up. So it is past. Next is tax हो गया. Dividend. Dividend is in financial activity. See the dividend paid. See whether number is going upward or not. It is going upward. It's very easy. Dividend हो गया. Then now I'll show the sales. Go here and see the annual sales, first number. Is it going from left to right? That's it. If you find this company in which all graphs are upgoing, this is the company. Now you know the names of company which you already aware. I'm sure we are using products and services. And if you find that 20 company which are like this, done. What shares to buy? MPTD's valid stock shares. That's it. When to buy? Buy every month. How much buy? You can buy in equal quantity. You can decide a little proportion as well. When to sell? After 7 years. How to buy? Buy SIP. There is a system in the brokers to do the SIPs. Shares. So I told you, ETF, shares, and if you are investing already in mutual fund, you convert to the direct plan. And there is something called as CARESA criteria, which I will not discuss today, but it's easy to do. So this is how I answered your question, grade and the products.